Hello, everyone. My name is Dr. Kyla Lara Breitinger. I'm a preventive cardiologist here at the Mayo Clinic in Rochester, Minnesota. And I'm extremely excited for our final three-part series, our third episode for the new dietary guidelines for Americans, with a good friend and someone I very much look up to, Dr. Steve Kopecky in our preventive cardiology division. Dr. Steve Kopecky is a cardiologist at Mayo Clinic. Interestingly, and a really fun fact is he originally was an interventional cardiologist before coming to the best side, which is now preventive cardiology. And he has written numerous articles for peer-reviewed publications in scientific journals. He's received multiple Teacher of the Year awards in both our Department of Internal Medicine and Cardiovascular Disease. His research interests include the role that lifestyle, including diet, exercise, and proper nutrition, play in risk prediction in the development of cardiovascular disease. He also has special expertise in statin intolerance, especially in our population affected by familial hypercholesterolemia. He also is the author of an amazing book called Live Younger, Longer. Welcome, Dr. Kopecky. How are you doing today?
Very fine, Dr. Kyla Lara Breitinger. Thank you for having me.
Okay, well, as you know, in our first episode, we had Dr. Darius Mozafarian come on and give his take on the new dietary guidelines. Tara Schmidt, our wonderful dietitian here at Mayo Clinic, then provided some practical guidelines. So, really, this episode is to hear about what you think is great takeaways from the new DGAs, what probably needs to be discussed a little bit more for the viewers out there, and how do we
Mhm.
translate these dietary guidelines for Americans into real world cardiometabolic care? So I'll set the stage for you there.
Thank you. So the guidelines come out every 5 years, as you know, and these were a lot different. The best thing, there were a couple of best things about it. One was the last guidelines were 170 pages. This was 10 pages. That's a plus, I think, for patients. Simple. The first line of the guideline, I think, is great. They say eat more real food. And that means they want to get away from the ultra processed foods. In fact, they put in there some foods actually to avoid. They're all highly ultra processed foods. The one thing that they really got right was saying don't eat these foods that are ready made, etc. And the data is very good that we're eating many, many more than we should, and it's leading to our early death, early dementia, cancers, other things. So I think, and this is the first guideline that really came out and kind of focused on that point. And I think it's really important for Americans, especially young Americans. My age group, we eat about probably 60% of our calories is ultra processed food. Younger Americans, your age group, 70%, up to 75 in some groups. So not you personally, of course.
You could call me younger.
Yeah, yes. But clearly it's something that we need to pay attention to help our patients. Now, some things that are a little there's some confusing things, but there always is a guideline. It's
Hmm.
always that way. You can't come out and be black and white and everybody agrees. And one of the confusing things is you can call it a pyramid, you can call it a triangle, you can call it a plate. I think it's like a triangular plate is what
Hmm.
their pictures that they had. And I think that the picture actually reflects, and along with the print version, it reflects what we recommend. Eat about 10% of our fats as saturated fats. You can have about 3 ounces of red meat, and in the Mediterranean diet, which we promote here, is one of the most studied diets we have that shows it reduces multiple things, not just heart disease, but cancers and Alzheimer's and other diseases that nobody wants to have. So the diet, as they give it to us, you have to take it in totality, not
Hmm.
just the picture, not just the recommendations, but all together in a very small, short package. And it does need some interpretation, I think, from dietitians, from physicians, from nutritionists, to help patients really do what's best for them.
And that's fantastic. I'm glad you talked about that. And I'm glad you said 3 ounces because for somebody like me, and many there are others out there, what does 3 ounces of
Mhm.
protein even mean? So we're hearing
Yeah.
in the guidelines, eat more animal meat. Doesn't really matter as much as saturated fat, but you mentioned 10%. So it could be misleading the headlines because in the details it does say 10%. So what is 3% to the average consumer out there?
Yeah, 10%. It can, for some Americans, can be 3 bites. An ounce. Some people eat an ounce of red meat at one bite, and you get 3 ounces. Now that was in the Mediterranean diet that's been very studied. The 3 ounces of red meat, and remember, red meat is not just pork or beef; it's also dark meat poultry or light meat poultry with the skin on. So the problem
Mm.
is, if you go out with your spouse to a honeymoon or a restaurant for your anniversary or birthday, and they bring you a 3 ounce steak, you say, "Where's the manager? What is this tiny little thing on my plate?" We're so much used to eating, bigger portions. And so portion size is important. Obviously, frequency of eating is important, and we're all eating probably about 4 or 5 times a day, not just 3 times a day. And then the density of food is important. But really, the ultra processed foods fit into three of those categories, to be honest, because we're snacking on quick foods like ultra processed food. We are getting a lot of calories, and we absorb more calories in the ultra processed foods. So I think that clearly we need to put this into a package that works for our patients. So what do I mean by that? Well, help them interpret this and not get caught up in the controversies, not get caught up in the politics. And there's a lot of politics, unfortunately, going on these days. But start to focus on what really can benefit them.
Mm.
And if you look at the picture of the triangular picture, and say how many things are in there. Well, there's about 35 different things on that in that triangle. Now, 14 of them, 42% of them at least, are fruits and vegetables.
Mm.
And these guidelines say, eat a couple of fruits and 3 vegetables a day. The things like carrots, broccoli, tomatoes, squash, bananas, avocado, those things are all good for you. And if you look back in our history on this planet, our species has eaten about 50% of our calories as carbohydrates with fiber. And fiber is a non caloric carbohydrate. And I
Hmm.
tell patients that because the only place you find it is in things that grow from the ground. It doesn't come out of animal products. And so you can eat something that'll fill you up and doesn't give you calories, and that's where all the fruits and vegetables fit. Now, the second thing on the picture is protein, dairy, and meats. And some people have trouble because it's on the top, but this isn't a pyramid. In fact, it's an inverted pyramid, a triangular plate. And I think plates are, people understand plates a lot better than they understand pyramids. I remember the one pyramid; it was a bunch of lines coming down from the top,
Hmm.
and that was really confusing. But the protein, the meat, the dairy, that includes some beef, some pork, poultry, egg. Again, if you're only eating 10% of your calories is saturated fat, you can't have a lot of these. You
Right.
have small amounts. Cheese, a couple of little dice, equivalent of dice of cheese that's in there. A couple of the dairy things, they're saying to eat 2 or 3 dairy things a day, but a couple of the dairy things are fermented, like cheese and yogurt, which we know are actually very helpful for us. They do have whole milk in there because whole milk has more protein. An 8 ounce glass has about 6 or 8 grams of protein in it. And then they have some butter, but you just can't eat as much as you want of everything you want. And that's the
Right.
thing to remember. They do have 3 different types of seafood, some shrimp, some salmon, some tuna, which we know is very helpful. So the meats, the proteins, people have heard this, eat the red meat, but that's more the hype. That's more the gotcha, the clickbait. When you look
Hmm.
at the
Clickbait.
actual, you look at what's in here in this guideline, and I think it's quite reasonable in that regard. It does encourage olive oil, avocado oil, nut oil, things like that. And then the third section of the triangular plate is the whole grains. And people say, "Oh, where are the legumes?" Well, they're there. A bean is a legume. A peanut is a legume. It has things on there like peas. They're a legume. They're a little more starchy, a little carbohydrate in them. But they really do have legumes on here. So they have a couple of nuts. They have some walnuts, some almonds, and some whole grains. And they put, looks like they got raisins in one of the whole grain cereals that they're eating. They have a whole grain bread. So I think this really fits with the Mediterranean that we've been encouraging patients to eat for years.
And I love that there are so many tidbits that I want to rapid fire back at you, as in which is worse, right? Because you mentioned butter.
Mhm.
So, what's worse, butter or coconut oil for people out there?
Well, some people really raise their LDL cholesterol with coconut oil.
That's
In
right.
fact, the head-to-head studies have shown it's you raise it more with coconut oil or palm oil than you do with butter.
Yeah. So, one of the most mismarketed health foods out there is probably coconut oil. Do you agree or disagree with that?
Overmarketed, I would say. Yeah,
Yeah, for sure.
right.
And then when it comes to the ultra processed foods, right? We talk about, well, what's available to Americans now. And right now, the food supply is 60 to 70% ultra processed foods.
Hmm.
So
Hmm.
now, like, let's fast forward to seeing a patient in the clinic, very busy day at work, and they don't have time to prepare fresh foods and
Hmm.
vegetables and whole grains and meal prep and do all the right things, right? And they have
Hmm.
the
Hmm.
education and they go to the grocery store, and 60 to 70% of everything they see is ultra processed. How do you pragmatically get them to now kind of slowly change in the direction that we
Hmm.
want for them to have an improved
Hmm.
anti-inflammatory lifestyle, an improved
Hmm.
gut microbiome,
Hmm.
etc.?
Well, again, it's all about the plate, and try to eat, 3 meals a day on a plate. You can visualize a plate. You can see what's on it. Where we get in trouble is the snacking, and snacking is easily 500 calories very often. And so the data has shown that people are eating at least 400 calories at least 4 or 5 times a day. And that's 2,000 calories. And then that's the snacks are less, meals are usually 1,000 to 1,500 calories. So you
Right.
easily get over the number of calories you should take. So I tell folks when you do want to snack, find the best thing you can eat to snack. And that is not something, in fact, they actually have on the booklet that came along with this diet. They say don't eat these ready to eat meals. Be careful with flour tortillas. Be careful with crackers. Be careful with white bread. And they've singled out those four foods, which I would have added in like sausage and hot dogs, things like that too, which have a
Hmm.
lot of chemicals in them you don't really need or want. But clearly, they're trying to say, when you do eat a whole food, eat a carrot, eat an apple, eat a small piece of meat, eat a piece of cheese, eat some nuts. That really, especially the cheese and the nuts, really sate you. Nuts have good
Hmm.
fat that fill you up and keep you full. But you don't need, 10 handfuls of almonds. Try just eating 10 almonds, you know, because that's
Right.
where you get in trouble. There's a lot of calories there and have some fluid with it, but don't drink your calories. I think that's something we have gotten into the habit of doing in this country. It's not just sugar sweetened beverages, which are, ultra processed, but also they're the herbal drinks. I mean, herbal drinks are great, tea and coffee. But when you start putting, some caramel syrup in it or chocolate syrup or sugary, things that have a lot of calories, that's where you get into trouble. So don't eat calories because our species has never really drank calories. We've drank fluid to quench our thirst, and we still do. We don't think of it as a calorie, and that's where we get into real trouble when with drinking our calories. So if you want to have something, have some water, have some sparkling water, something like that. Have some tea, a coffee, but don't put calories in.
Yeah. And I agree with all of that. Do you think that as a species, though, our palates have evolved to now be addictive to these forms of foods, of ultra processed foods? And in that case, somebody who spent the last 10 years or all of their adulthood eating these ultra processed foods, they might not want to go for the carrot, right? They might not
Mhm.
want to go for the
Mhm.
hard boiled egg. Do you have any
Mhm.
advice for those listeners out there where this transformational, like day and night type of a change may not be as sustainable for them?
Yeah, try to find something you like that's healthy. It may be a small thing, one bite, or put
Hmm.
something on it that you like some spices. that are lower calorie. You can make something that's kind of mundane and something very tasty with some good spices, and there are a lot of them out there. So try that and do it in small portions and start to fill your plate with that before you add these other things. Start to pile up all the things that aren't as healthy for us. And it's a slow process. We all
Hmm.
tend to think, okay, I'll change. Oh, doctor, I'll change my diet tomorrow. I promise. I will change. I will only eat, carrots and paper, cardboard, something like that, which isn't going to last more than about 20 minutes. But I say, just take one bite at a time. It really is a small change. Why is one bite? Because we know that one bite can make a difference after a couple
Hmm.
of years in lowering your heart attack rate. One bite of ultra processed red meat, which has a lot of chemicals and sodium in it, one bite less can lower your risk. Trading that red meat for a legume or a black bean or something like that can start to lower your risk. So just do little things over time and find ways that you like to eat them that really do, fulfill you and sate you and please you.
Yeah, I think that's a great kind of stepwise approach to that. And so, I guess what I'm thinking about next is for patients out there who are told for the first time they have prediabetes or metabolic syndrome or
Mm-hmm,
cardiometabolic disease
hmm
or kind of elevated blood pressure, and they're very averse to starting medications, right? You and I both have patient
hmm
populations
Yeah.
that are kind of, at that threshold. They're not in that elderly population yet where kind of medications, the train has left already, as I
hmm
say. And so, how can they change their nutrition to avoid full out diabetes, to avoid kind of that visceral adiposity, that kind of normal weight obesity,
hmm
where all of those
hmm
cardiometabolic factors like your HSCRP, your high sensitivity C reactive protein, your
hmm
lipids, your triglycerides, right? Your
hmm
insulin resistance. Do you counsel patients individually based on their kind of phenotype or depending on how they distribute their fat versus skeletal lean muscle mass, if they're insulin resistance, and
hmm
what types of food you push forward to them to kind of help them with their goal, which is to avoid medications in their future?
Yeah. Great question. And clearly, it's not only about the diet, first off, it's also about the physical activity. It's how they manage their stress, because stressed people eat more foods that aren't good for them. It's how healthy their sleep is, because they don't get good sleep, then they get more hungry throughout the day. So that's really important. And we can't forget about that because it has to be looked at in totality. The second thing is, some of the foods are a little better to eat. Maybe a little bit of red meat, a little bit of fermented dairy, yogurt, cheese, things like that. A little better to eat in terms of the diabetes. Maybe an egg. You don't need have a 3 egg omelet with three yolks in it. Maybe you can have a 3 egg omelet with one yolk in it. And put something else in there that you enjoy. Clearly, if you uh, and the way you eat, where you eat, what you're doing while you eat is very important. So, say you get on watch TV, after a while you think, "Oh my gosh, who's been eating all this food?" And you're thinking of something else. The eating should be the center part of what you're doing. Maybe with your spouse or loved ones or families or friends, that's great, but don't do it while you're doing something else like driving the kids to the soccer practice, because then you just wolfed something down that you really wish you wouldn't have done later.
Yeah. And it's really important because what it sounds like you're describing is just mindfulness and mindful eating. And it's so interesting that, when I meet people across the world and they say, Americans, they're always in transit
Mhm.
when they're drinking a cup of coffee, when they're eating something. And you guys carry around these large jugs of everything in food and in pockets and in this and that, where, there's special tea time where we focus and feel the temperature, we smell the
Yeah,
aroma and really slow
yeah,
down and take the time.
yeah.
But, this is what our society has evolved with, this convenience, very quick bait, getting through everything. So if we could slow down and actually pay attention to what we're doing, especially when it comes to
Mhm.
eating, as food is
Yeah.
medicine, it's super important to slow down. And so, I love that you mentioned those things. Another question I have is, when it comes to the media and the headlines. How do you combat that with patients? I had patients tell me they're on the lion diet, right? Which is a more aggressive form of the carnivore diet where
Hmm.
they're
Hmm.
using a rudimentary
Hmm.
extra gut for processing, where, it's a severe form of almost the Paleolithic diet. And in some forms, right, they could associate this particular diet with whole foods and say
Hmm.
this is probably similar to the
Hmm.
DGAs. And as preventive
Hmm.
cardiologists, you and I, how do we meet them in the middle
Hmm. No,
to help them see this, right? Because they could find a
right.
podcast out there. They can find on ChatGPT, on Google, you could find any bias you want that is partial
Mhm.
to your beliefs. But at the end of the day, we're not ran by industry as cardiologists. At least I hope not. We want just the best health for our patients.
Yeah, no, it's so true. And I do think that a little bit of education goes a long way in speaking to patients at a level they understand. And that is to say, calories do matter. We know that from the GLP-1 drugs that have us eating less calories and we lose weight. You talk to people that are in movies and they need to lose weight for a movie. And they go to a nutritionist and they'll tell them what to eat and tell them exactly how much weight they're going to lose after 6 or 8 weeks. This it really is about the calories. So help them understand that that a calorie it really counts, but also a calorie is not equal. Ultra processed calories are really, you gain more weight from them, you've absorbed them better, you get more addicted to them. A lot of things happen that aren't good. Now, the ultra processed foods, people, and you've talked to them, Kyla, and they'll say, "Oh, doctor, I don't ever eat junk food. I never do." I say, "Well, do you eat ketchup?" "Well, yeah." "Okay, half of ketchup is, ultra processed sugar." "Or doctor, I eat only organic." In fact, one patient, I said, "Well, what do you have?" He said, "I have these bars." I said, "Well, what's in them?" He goes, "Well, here, I got one in my bag." Showed it to me. And I said, "This may be organic, but it's organic, ultra processed, high fructose corn syrup." and, and so you can't assume that something that says healthy or organic on the outside is really good for you. And the patients, I actually recommend that they use the Yuka app, Yuka. It's a free phone app. You aim it at the barcode on a food at a
Hmm.
point of purchase, and it'll tell you within seconds, as you know, what's in it. And it'll give you not just calories and sodium, but also what are the additives. And the
Hmm.
additives, if you need to go back to your high school chemistry book to figure out what these additives are, then don't buy us.
Right.
There's too many compounds in there that aren't natural. And the ultra processed foods, I think they're slipping into our diet much more than we ever thought. I mean,
Hmm.
literally, it's well over half, 2/3 of our diet, and that's everybody. I mean, we're all, because why? Because, well, at home we can control what we eat. What about when we go to a friend's house? What about when we go to a restaurant? What about when we go to a ball game and buy a hot dog or something? It happens. And I just have to tell patients, life happens.
Right.
You go to a friend's house for 4th of July picnic or something, have the potato salad from grandma, that's great, but just don't do it every day. And when you can control it as much as you can.
Yeah, and it sounds like what you're saying is like food culture around events and life is really important in terms of quality of life, and I can't agree more. Now you mentioned GLP-1, and so interestingly, it's, not the elephant in the room, it's the
Mhm.
skinny elephant in the room actually.
Mhm.
And so many people out there are probably on some kind of microdose of it, right? Because we know of
Yeah.
the anti-inflammatory effects
Hmm.
outside of just pure
Sure.
weight loss. And
Hmm.
how would somebody who's managing these microdoses or regular doses,
Hmm.
maintenance doses of GLP-1 receptor agonists, how would you apply the new dietary guidelines when they're already feeling pretty satiated, nauseous, and they're
Hmm.
eating,
Hmm.
800 to 1200 calories? What should they
Hmm.
be going for first when they are
Yeah.
eating?
And one thing about GLP-1s, they can reteach us how to eat. And that's very, very important. We've forgotten. Kids in this country up to age 3 have the healthiest diets of any children in the world. By age 9, our kids in America have the worst diet in the world. Why is that? At age 5 or 6, they go to a friend's house, get some super sugar, puff cereal, and they come home and say, "Mom, Dad, I'd like some of that cereal." And their diet plummets in terms of quality. So what about the GLP-1s? Well, number one is don't drink your calories. but
Hmm.
do drink at least 3 liters of fluid a day, because the motion of your gut, the peristalsis, which is the activity that propels the food through the gut, slows down so much. You have to drink more, because otherwise you'll get so constipated, because the food
Hmm.
just sits there and all the fluid comes out. Secondly, eat the really good stuff first, because
Hmm.
you're going to run out of room. You're not going to have room in your stomach. What do I mean by the good stuff? Eat, some protein, and not the protein that is a bar. You can buy in a bar that's in a wrapper that says, "Oh, this is if you're on a GLP-1, eat this protein bar." No, eat a pure piece of, a smaller piece of pure meat, chicken breast, something like that. Have something. The only thing I will say to drink calories is maybe a protein drink that you
Hmm.
make with a smoothie, with putting some fruits and veggies in there, a little ice, maybe some protein powder, whey or something like that. That's reasonable, but you're doing that, that'll start to fill you, because it has all the pulp and fiber in it from the fruits and the vegetables that you grind up. So a couple of things there, and then and for the sweet stuff, if you want something sweet, that's okay at the end, but get some dark chocolate.
Hmm.
And you'll have to find your percent. 70% dark chocolate can be a little bitter. Maybe
Hmm.
more down to 40 to 50%, whatever, and work your way up. But still enjoy things, but just be smart about it. And the point is, you will then learn after you go off the GLP-1, or even when it's the end of the week that you're on it, where there's less effects, you'll learn how to eat better and
Hmm.
enjoy it more. And that really is important, and it empowers people, I think. And many of my patients, just as yours, have told you, "Doctor, I don't have that voice in my head anymore telling me to eat." and
Right.
That's really, really important. And that's where it works into the addiction of alcohol and smoking and things like that.
Yeah, and I really couldn't agree more. It's almost like these GLP-1 receptor agonists and all the dual agonists and triple agonists that are coming down the pipeline are really going to be the answer, the antidote to this convenience culture, ultra processed kind of society that unfortunately has evolved because of every the science, technology, not enough time to do anything and sit down and be mindful. And so I definitely appreciate all of those
Mhm.
tips that we all
Mhm.
could learn from. So in the final 60 seconds or so,
Yeah.
give us your Dr. Kopecky live younger, longer. If I could see you, not everyone could come and see you as their
Mhm.
preventive
Mhm.
cardiologist. What
Mhm.
is the kind of elixir, would you say, when it comes to food and longevity and overall health?
Yeah. It's really one bite at a time. And I can't emphasize that enough. Every bite we know is important. Be just as careful what you put in your body as you are careful about the gasoline you put in your car, or the detergent you use to clean your clothes or something like that. It is so important what we put in our body, and we treat it as, no, it's just a tube. I'll just put it in, and it'll just go right through me. It won't affect me. That's not true, and it can really make you so much healthier. Be Start to learn where the ultra processed foods live in your diet and in your day, because they will sneak in there. And if you want to have a bite, I love Oreo cookies. I have been known to buy a bag of Oreo cookies, eat half a cookie, and throw the rest of them away. That's just, especially at Halloween when they got the orange and the black ones. Those are so cool. So, still enjoy it, but be smart about it. That's really, really important. And then last is, try to take care of all of you, not just the stress and the sleep, but the exercise, those things. The leg bone's connected to the hip bone, and
Hmm.
how you eat is also affected by how you sleep and how you mitigate your stress. Notice I didn't say get rid of stress, since none of us can get rid of stress. It's ubiquitous in the world now. And that's especially true for the younger generation. They're the most stressed generation we've seen in our society ever in this country. There are little things every day. Don't give up on it. If you don't do a perfect job today, hey, with your job, your occupation, whatever it is, you come back tomorrow to work and you try to do better. The same with your diet. If you mess up and eat some things you shouldn't have, and you feel real bloated or full, or feel kind of embarrassed, just learn from it. Go on the next day and try to do a little better, one bite at a time.
one bite at a time, and I'll leave it at that. That is wonderful, wonderful advice. And we super appreciate all of these facts and tidbits and advice you've given us, Dr. Kopecky. And so thank you so much for joining us. And that concludes our 3-part series. Thank you so much, everybody, for joining.
Thanks for having me.
At Mayo Clinic, relentless learning fuels world-class care. I'm Dr. Rajiv Gulati, Chair of the Division of Interventional Cardiology. If today's episode gave you a fresh insight, imagine what a full course can do for your patients. Head to cveducation.mayo.edu and explore our live and online programs, our quick on-demand modules, and our CME accredited masterclasses created and taught by the very voices you trust here. Join thousands of clinicians who've already turned curiosity into expertise. Level up your practice now at cveducation.mayo.edu.